Hi there, this is Dr. Brett Bingham from Intermountain Pet Hospital. Welcome. So today we've got a really fun topic that we're going to talk about, and a little bit controversial, which is kind of fun. Controversy seems to be a big part of our society right now, and this is going to be a very less controversial but interesting topic. So it's when to spay and neuter your pet. And a few years ago, the answer was very easy. People would come in, we'd sit down with them. People were like, when should I spay or neuter my dog or my cat? And the answer was really easy, and we just told everybody around 6 months of age. 6 months was the standard one-size-fits-all answer. When they hit that 6 months of age, we get them all spayed or neutered. That is still the case with cats. In case you're wondering, we still spay and neuter all cats around 6 months of age. And the reason why we do it at that point is because once cats go through puberty, they go crazy. So their hormones make them do crazy things. And we've even had owners come in because their cat was in heat and they thought it was having a seizure, because it definitely changes their behavior. And unless you want kittens and you want to deal with that crazy behavior, you can let them go through their puberty. Otherwise, 6 months of age on all cats. Dogs, not so much. So there is no one-size-fits-all answer for dogs. It depends on so many things. It depends on their breed, depends on their size, how big they're going to be as an adult. It depends on what they're going to be used for. It also depends on their exposure to other dogs. If they're going to be exposed to other intact dogs that could create pregnancy where it's not really wanted. So there's a lot of things that go into dogs, and a lot of research has come out over the last couple of years that has given us some guidelines. So what we do is when we're in the exam room and we've got a pet in there and the owner's like, I really want to know the best time to spay or neuter my pet, then we talk about that individual pet, look at the pros and cons, the risks, benefits, and decide on the best time to do it, because there really is no one-size-fits-all answer. They're all a little bit different. But there are some guidelines, and we're going to talk about some of those guidelines right now. So bottom line, what the studies are showing is that dogs that are spayed or neutered too early, when I say too early, that's before puberty, and puberty happens between 9 and 11 months of age. That's when they develop all their sexual hormones. So before that, so if they're spayed or neutered before that, the studies are showing a significant increase in the risk of orthopedic disease. And when I say orthopedic disease, it's the whole gamut of orthopedic issues. A significant higher incidence of ACL injuries, which are the same thing that happens in football players. They get the cranial cruciate ligament, anterior cruciate ligament. So significant higher ACL injuries in the knees, hip dysplasia, elbow dysplasia, and just general arthritis. So if they're spayed too young, they have a much higher incidence of orthopedic issues. There's even some studies that have shown a higher incidence in some cancers. And when I say cancers, mainly hemangiosarcoma and lymphoma. But I do have to say that was a very limited study. You got to take the results with a grain of salt. It may not be 100% accurate, but possibly. So it could possibly decrease the risk of some cancers by letting them go through puberty, but certainly orthopedic disease. As far as size plays a big difference. The recent study done by University of California in Davis looked at the size of the animal, not so much the breed, but the size. And what it suggested is that dogs that are going to be larger than 45 pounds as adults have a significantly higher risk of orthopedic disease if they're spayed early. So bottom line, the smaller the breed, the better it is, or I guess the less risk there is to spay and neuter early. So a Yorkie, for example. So I would have no problem spaying or neutering a Yorkie at 6 months of age, because they just don't develop orthopedic diseases like the larger breeds. And their risk of cancer is really not as high either. So no problem spaying or neutering a Yorkie at 6 months of age. I would have a whole different discussion if it were a Great Dane. And so there's really three categories. So if you have a small breed, that's going to be less than 15 pounds as an adult, usually we want to do those around 6 months of age. If you have a dog that's kind of middle size, like 30, maybe to 40, 50 pounds as an adult, then I would suggest having, if it was a female, letting him have one heat cycle. And that heat cycle is going to happen around 10 months of age. And then you want to wait about 3 months to get them spayed. So we shoot for 3 months after that first heat cycle. And the reason why we shoot for 3 months is because dogs cycle on the average every 6 months. So you want to go right in the middle. So you want to wait for all the hormones from that previous cycle to go dormant before they start to ramp up again for the next cycle. So 3 months after the first heat cycle. Now if you have a giant breed dog like a Great Dane or a Mastiff, Newfoundland, I recommend 2 heat cycles. So let them have heat cycle, which probably happen around, 11 months of age, and then it'll probably happen 6 months later, and then 3 months after that is when you spay and neuter. And for those larger breeds, middle and larger breeds, laparoscopic spay is the way to go. That's where we make 2 little incisions in their abdomen, one in front of, one behind the belly button. We go in there with the camera with one of the incisions, and then instruments with the other one, and so we can spay them through those 2 little tiny incisions. They go home the same day, and within 24 hours they're back to normal like nothing happened. So laparoscopic spay, especially for middle-sized dogs and large breed dogs, or if they're really active, those are the dogs that are awesome for doing laparoscopic spays because they just recover so much easier, less pain, less swelling, less risk, less bleeding. It's just kind of a no-brainer. In fact, I had somebody request to do a giant breed dog traditionally a couple weeks ago, and I said no, it's just not worth it for me. And the laparoscopic is really the only way to go when you have a giant breed dog. Just less invasive, less risk, less pain. That's the way to go. Another thought that I want to share is one of the arguments before was, well, we should spay them neuter or spay dogs young so they don't develop mammary cancer. Okay, and there is some merit to that. You know, the more heat cycles they have, the higher the risk of mammary cancer. However, I will say that most dogs that develop mammary cancer don't have metastatic disease. They'll develop a mass on their mammary gland, but it doesn't metastasize. It's not all cases, but most cases it doesn't spread to the rest of their body. So even if you let a bitch have 2 or 3 or 4 heat cycles, and then you spay her, if she does develop a mammary tumor at some point in her life, in most cases removing that surgically will cure the problem. Not all cases. But that's one of the big arguments that a lot of veterinarians and others will say is, well, you got to spay them young so they don't develop mammary cancer. And what I'm saying is that's not that big of a deal. If they do develop a mammary cancer, in most cases, excising it will cure the problem because they rarely metastasize. So keep that in mind as well. It's okay to let them have a couple heat cycles. Probably the biggest risk is a mammary tumor. And as they get really old, like 7, 8, 9 years of age, they can develop pyometra, which is a uterine infection. And I don't recommend any female that old being intact. They should be spayed. If you're not going to breed them at 4 or 5 years of age, you should spay them because they're going to have issues in the future. Almost all of them do eventually, so get them spayed at that point. But the sweet spot is 3 months after the first heat cycle, or if it's a giant breed, 3 months after the second heat cycle. So, neuter. Let's talk about neuter. And if there's any questions out there, feel free to send them my way and I'll answer them. But neuter. Neuter is a little bit different as well. Kind of the same thing. So, we want the males to go through, puberty, basically, which is around 10 months of age. That's when they develop. And maybe even wait a couple months after that. So maybe a year and a half. For the small breeds, it doesn't matter. You can do those young. You can do those at 6 months of age, no big deal. But for the mid-size or larger breed, you want them to be really at least a year of age. But I will tell you that even at that point, it's okay to leave them intact. Those hormones give those ligaments and tendons and muscles strength throughout their whole life. You know, it's testosterone. Testosterone makes dogs strong. And it keeps the males more lean. You know, when you neuter a male, they're more likely to get overweight, which is a risk factor for arthritis. So take your time. Even though if they're a year of age, if they're doing great and they're not marking your couch or your bed, which I would neuter them if they were doing that in my house. But if they're not having any behavioral problems and you're not worried about them breeding the female next door, you don't have a female that's intact that you worry about them breeding, and they're doing great, leave them intact as long as you can, because those hormones are going to benefit that dog for its health. Now, one of the arguments that you'll hear is, well, they'll get prostate cancer. So if you don't neuter them young, they'll get prostate cancer. That is totally not true. There's no evidence at all that proves that. What does happen and can happen is they can develop prostate hyperplasia. We call it benign prostate hyperplasia. That's where the prostate can get big and inflamed and swollen. But if or when that happens, they're usually older, like 7, 8, 9, 10, 11, 12 years of age. And neutering them at that point will resolve that problem. So prostate cancer is not a risk factor for an intact male dog. Prostate hyperplasia is, but that's reversible with neuter. So again, take your time. Let them go through puberty, and if they're doing great, let them keep those hormones, because they will be stronger, healthier, faster, less likely to get injury, less likely to have obesity. They will be a healthier dog. So if you can keep your male intact as long as you can, great. At some point, if he gets older, 7, 8 years of age, and we're worried about the prostate, we can neuter him at that point. That's a good time to do it. So bottom line is, there is no one-size-fits-all answer for the best time to spay or neuter. It's best just to let them go through maturity. Unless it's a small breed, then you can do it when they're young. And weigh the pros and cons. And this should always be a discussion with your veterinarian. You should always sit down with the veterinarian, like, this is what I'm going to use this dog for. This is going to be our lifestyle. This is how big the parents of this dog. And you put your heads together and you decide the best time to do it. But that should be a discussion that you have with your veterinarian, talking about the pros and cons. But it's not black and white like it used to be. It used to be, yeah, we do them all at 6 months of age, done, no more questions. Now we do it on a very individual basis. We talk about each individual patient. But you can see, by the things that we talked about, that there are some general guidelines. There's some science out there. We have a lot of science to back up what we're doing. And hopefully, by doing so, we can protect dogs from orthopedic issues and protect them from some cancers, and have them live a healthier, stronger, and happier life, which is our goal. But if you have questions, shoot them out, and we'll bounce answers back to you. Hope that answers questions. Have an awesome day.